Thank you for tuning into our best practice series for medical providers working with refugee and immigrant youth and families. This is one video in a larger series hosted by the Trauma and Community Resilience Center at Boston Children's Hospital. Each short video will highlight experts in the fields of medicine and psychology who work with refugee and immigrant youth and families. We are grateful to SAMHSA and the National Child Traumatic Stress Network for their support in making this series happen. In this video, we will be hearing from Dr. Alisa Miller. Dr. Alisa Miller is a psychologist in the Department of Psychiatry and Behavioral Sciences at Boston Children's Hospital and the Associate Director at the Boston Children's Hospital Trauma and Community Resilience Center. She is also the co-director of Project EPIC, Enhancing Pediatric Integrated Care, located at Boston Children's Hospital Primary Care Center and Martha Eliot Health Center. Dr. Miller's expertise is in promoting the mental health and well-being of youth from communities that have experienced high levels of trauma, adversity, and stress, specifically refugee and immigrant youth in the United States. Dr. Miller is interested in increasing health equity for all youth in our society and strives to innovate, value lived experience, and advocate to make services that are meaningful and relevant to youth, families, and providers. And now it is my pleasure to turn it over to Dr. Miller.
Thank you so much. I appreciate the invitation. So, for a little background, many refugee and immigrants come to the United States from non-English speaking countries. And as a result, a vast number of languages and various levels of English proficiency exist among these groups and across the United States. Until recently, the US did not have an official language. On March 1st, 2025, an executive order was signed declaring English as the official language at the federal level, the first time in our nation's history. English has served as the primary language in the United States since its founding. The US is one of the most linguistically diverse countries of the world, with over 350 languages, both indigenous and immigrant, being spoken. In the medical context, it's really important to use a trained professional interpreter. Medical interpreters receive extensive training in medical terminology in both English and the target language of the patient, ethical and some legal issues, as well as interpreting skills. They also abide by the Professional Code of Ethics and Standards of Practice. These trainings ensure accuracy and impartiality, maintaining confidentiality, and avoids misinterpretation of medical terminology or sensitive issues, as well as leads towards transparency. It is highly recommended to use in-person interpreters when possible, or phone or video remote interpreting if needed. A quick note on ad hoc interpretation. Ad hoc interpretation refers to interpreting that is done by a person who is not trained as an interpreter, but happens to speak the two language needed for a specific interaction. For example, a bilingual receptionist, nurse, or family member may be asked to interpret if a trained interpreter is not available. For many reasons, ad hoc interpretation is not recommended, or at the least should be kept to a minimum. Never use a child, family member, or friend for interpretation. While a child, family member, or friend often serve as interpreters in a pinch, using them is unwise because of the difficulty they may have remaining neutral. And although they may have the best intentions, upsetting or embarrassing information shared in a medical setting or situation can be difficult for them to serve as interpreters. Emotions can easily cloud thinking, and this does not make for accurate or useful translation. Children are sometimes asked by their parents to translate. This is suboptimal for a variety of reasons, including that the child may be exposed to adult matters that might cause them distress or from which adults ordinarily would shield them. Additionally, putting children in the powerful position of gatekeeping the information they share with or express on their parents' behalf often undermines parental authority. Interpreters serve as verbal connections between people who need to communicate but do not speak the same language. An interpreter's job is to relay what is said in a conversation by interpreting each speaker's message for the other speaker. Typically, the interpreter will simply take the words from one language and interpret them into the other language. Interpreters employ 4 different modes of interpreting to fit specific circumstances. The 4 modes are consecutive interpreting, simultaneous interpreting, sight translation, and summarization. Consecutive interpreting is the process of repeated back and forth actions of the interpreter silently listening to the speaker's message and then relaying it. Simultaneous interpreting is the process whereby the interpreter relays the speaker's message while the speaker is speaking, following only a few words behind them. Sight translation refers to when an interpreter reads a document written in one language and then reads it aloud in another language. Summarization is the process whereby the interpreter summarizes the important points of the message once a speaker has finished. Importantly, or interestingly, to note is that only American Sign Language interpretation happens simultaneously. There are a multitude of medical situations one might be asked to interpret in, and there are 4 basic roles that interpreters will fall into as a function of their job: conduit, clarifier, cultural broker, and advocate. As a conduit, the interpreter translates exactly what is being said in one language into another. As a clarifier, the interpreter ensures understanding between parties. As a cultural broker, the interpreter gives clinicians a framework in which to understand a client's cultural perspective. As an advocate, the interpreter takes action to ensure the clients receive what they need or have the rights to receive. The interpreter is not a mental health service provider. Clinicians must have proper training and licensure. Interpreter is not a close friend or family member. They are professionals and do not provide substantial emotional support to clients or their families. And they are not case managers. Interpreters and case managers have distinct roles, chiefly distinguished by an interpreter's strictly linguistic and cultural support and a case manager's coordination of clinical services. It's important for medical providers to understand the boundaries of their interpreter colleagues' roles and responsibilities. The foundation for all healing proceeds from the medical provider and interpreter professional partnership. Building trust and collaboration between the medical provider and the interpreter is essential. Interpreters are cultural brokers as well as language professionals. So encourage them to share cultural insights that may affect care and respect their neutrality, but also welcome clarification on cultural nuances that could impact communication. The dyadic partnership between you, the medical provider, and a professional interpreter really provides this foundation of healing, and building trust and collaboration between the 2 of you is essential to support the patient and provide them with a valuable and reliable team in the medical setting. Whenever possible, meet with the interpreter briefly before an encounter, and especially if you're about to deliver bad news to the patient or family. Give a quick overview of the purpose of the meeting and if any sensitive topics may arise. If known, discuss any linguistic considerations, like if there's a certain dialect or regional language that the interpreter should be aware of. Ask the interpreter to clarify if any cultural differences may be affecting the understanding within the medical setting. So are there different concepts of health or healing happening? Are there gender roles that should be identified or understood as you're moving through? And importantly, establish a signal that the two of you can use if you need more time to talk about a particular topic or if there's more time needed for the translation. The medical provider interpreter dyad partnership is put into practice through communication in a triad. So the triad is made up of you, the medical provider, the interpreter, and the patient. Communication between and within the triad is critical to supporting the medical situation. To optimize this communication, it is important to understand the roles of each person in the triad. And when possible, you want to position yourself in a triangle like this so that everyone can see each other and is attentive to each other. So as you can see in this triangle, it's really important to note that it is the interpreter who has understanding of both nonverbal and verbal communication in this encounter. Working with an interpreter is like a dance. So where you come together, you need to get a little bit of a rhythm. So during the encounter, you need to think about communication as this dance where you're taking a moment to get into a rhythm together. You might step on each other's toes a little bit. That's to be expected, but really to understand and appreciate how to work together. You can promote a more natural working style in the dyadic partnership if you speak to and look directly at the patient, not the interpreter when you're talking, and vice versa. You want to use first person language. So you want to say, "How are you feeling today?" instead of ask him how he's feeling. Medical providers and interpreters need to be aware of the language register of the patient. A language register is just the way we change how we talk depending on who we're with and the situation. So we all do this naturally, right? So we talk differently at home than we do at work or how we talk with friends or family. It's important to choose an appropriate register so that that patient feels respected and understood. It will also allow you and the interpreter to adjust your words to match the patient's level of understanding. So it'll be important also to make sure that you're using language that's age appropriate to the patient. So a 5-year-old requires language that's different than a 10-year-old that requires language that's different than a 30 or a 70-year-old. You want to make sure that you're speaking in short and clear sentences, pausing frequently, and allowing time for interpretation. Remember, it is mandated that an interpreter interpret exactly what is being said, word for word. And a lot of times there is not a word for word translation between languages. So trust that the interpreter is doing their best to convey the information. It's also important to avoid metaphors, idioms, acronyms, and medical jargon. So avoid idioms like, let's say, for example, we're keeping an eye on it, or it's touch and go, right? So those are metaphor idioms. These often don't translate well across cultures and can lead to misunderstandings. So if you're going to use them, make sure that you explain them clearly. Spell out any acronyms or use full terms. For example, say blood pressure instead of BP or intensive care unit instead of ICU. Patients often don't know what these abbreviations mean and may feel uncomfortable asking. And then you want to replace any sort of jargon with plain language. For example, you would say, "You have high blood pressure," instead of saying, "You're hypertensive." Even when you interpret correctly, specialized medical terms may not be understood without plain language explanations. So some considerations during the encounter. You also, in addition to verbal communication, you want to be attending to nonverbal cues. So is the patient only looking at the interpreter, looking at the floor? Do they seem uncomfortable? You want to be picking up on those and trying to assess for those. Also, it's important to note that an interpreter can sight translate short paragraphs, but instructions or long texts need to be interpreted orally, and interpreters will need to interpret everything that's said in the room. So make sure that you're only saying things that you want everybody to hear. So avoid side conversations, right? And then also take care to advise the interpreter to use contact precautions if needed. So if they need some universal precautions, please let them know. All right. And then you want to check for understanding, not just agreement throughout the encounter. So don't assume like head nods or yes, yes means full comprehension. Ask open-ended questions like, can you tell me in your own words what you understand about your diagnosis or your medication to check for understanding? Encourage the interpreter to speak up if clarification is needed. Use the teach back method and open-ended questions. For example, you could confirm a patient's understanding in their own words by saying something like, I just explained how to take your new diabetes medication. So I can be sure I explained it clearly. Tell me how you'll take your medication at home. Or you could say something like, tell me what you understand about your high blood pressure or how you're supposed to manage it. Or you can use open-ended questions and say something like, what do you understand about your diagnosis? Describe what your stomach pain feels like and when it usually happens. The purpose of these is really to confirm understanding without making the patient feel tested, identify gaps in communication, and reinforce learning and clarifying misunderstanding. By using the teach back and open-ended questions, providers, interpreters, and patients work together to ensure information is clearly understood, culturally responsive, and accurately followed. After an encounter, um, we would encourage you to take time to meet with the interpreter, discuss what each of you understood about the encounter. You could explore what each of you noticed that was important. You could clarify areas of confusion, follow up with questions, observations regarding cultural context, and then, of course, attend to the relationship. Building that relationship by identifying for each other areas of improvement, how you can get your dance more of a natural rhythm, and then also celebrate what went well in the communication. And then finally, culturally responsive care encompasses significantly more than just bridging a language barrier. It's also about approaching each patient with openness, respect, and a willingness to learn. When working with interpreters, medical providers play a key role in creating an inclusive and safe space where refugee and immigrant patients can feel seen, heard, and understood. So there's a few recommendations that we have here for being culturally responsive. The first is reflect on your own biases. We all have unconscious biases. The key is to recognize them and not act on them. And of course, it's really important to stay open to learning. Practice cultural humility, the ongoing commitment to self-evaluation, curiosity, and mutual respect. Next, understand that culture shapes health behaviors and beliefs. So patients may have different understandings of illness, healing, and medication. Some may favor traditional remedies, have specific dietary practices, or view health through a variety of different lenses. Ask open-ended questions. Can you tell me how your family understands illness? Are there traditional treatments you've used to help in your healing? Next, respect the patient's cultural identity. So don't assume that one person represents their entire culture. Be aware of differences in gender roles, religious practices, and family decision making within a culture and also between cultures. Next, be aware of power dynamics. So, refugee and immigrant patients may feel intimidated by providers or institutions due to past experiences of authority. They also might have a deep respect for experts in medicine and institutions. So, you want to convey uh, and speak in some warmth, respectful, non-judgmental tone. You want to use body language that really conveys attentiveness and respect. Next, you want to clarify and avoid assumptions. So never assume that English proficiency means full health literacy, and do your best to explain what you need to. And then also recognize that compliance issues may not be due to unwillingness, but rather they may be due to critical factors such as cultural misunderstanding, fear, or a lack of resources. And it's also important to understand the impact of trauma and migration. So many refugee and immigrant families have experienced trauma, displacement, and loss. So be sensitive to signs of distress. Avoid pressuring patients to disclose personal experiences unless they're relevant and safe. Use trauma-informed care principles of safety, trust, collaboration, and empowerment. And lastly, be patient and allow time. Culturally responsive interpreted services or visits, encounters really require extra time. So avoid rushing. Patients may need time to reflect, consult with family, or ask questions in their own way. When medical providers and interpreters work as a team, care for refugees and immigrant youth and families become more effective, compassionate, and culturally responsive. And then finally, language access is vital to health outcomes. So, lack of communication can lead to mistrust, fear, and disengagement, especially for marginalized and/or refugee and immigrant communities. Language access is critical to medical outcomes because effective communication is the foundation of safe, equitable, and high quality healthcare. Providing health services in an individual's preferred language ensures more accurate diagnoses, informs treatment planning decisions, allows for informed consent and autonomy, promotes medication safety, and then helps with chronic disease management. And importantly, language access isn't Language access also increases patient engagement and trust. When patients feel understood, they are more likely to follow care plans, return for follow-up, and ask questions. So language access isn't just a service that you provide, it really is an essential life-saving tool. So thank you for doing your best to provide the very best language access.
Thank you so much, Dr. Miller, for sharing your expertise with us. And we want to thank you all for watching. If you're interested in learning more, visit our YouTube channel for more videos. The link is in the video description.